there is a true connection, and it can be measured, and we can see the difference in fatigue behavior of the patients. We can see a difference in other health systems and organ systems when interventions are made by, in the airway space.
At the intersection of airway, sleep, dentistry, and whole body health, 3 leading experts come together for one evidence-driven conversation. Dr. Barry Raphael, integrative orthodontist and co-founder of the Airway Collaborative. Dr. Richard Stevenson, award-winning educator, author, and authority in restorative dentistry. Dr. Mark Cruz, respected lecturer, clinician, and contributor to national dental research, where science meets clinical insight. This is Airway Nexus.
Richard, I see you're eating. How are you doing, my friend?
I'm doing great.
Good,
I've
ready?
been going nonstop all day.
Yeah, me
So
too.
I threw something in there. Good to see you, Mark.
Yeah, no problem. Me too. So let's begin our podcast, and do apologize for my temporary setup here right now. I have a professional setup that's not quite ready, but we do still want to have our discussion, our weekly discussion. And what we will do is we'll go through a couple questions and that have been submitted for us to talk about. And the first one is why airway health is the missing link behind sleep behavior, and long-term health. So why don't we talk a little bit about that? What is this link behind health and sleep, health and behavior, health and long-term health? And of course, we've been talking about this for a while, haven't we, Richard? Any comments on that?
Absolutely. Yeah, we completely have. It just seems that so many people today are suffering from sometimes conditions that cannot be explained by their physicians or their healthcare providers. They've sought all kinds of remedies. It's like there's very few people I speak to today that don't feel fatigued, stressed, anxious, have someone in the family that's suffering, and I, they're seeking solutions all the way from excessive amounts of yoga, supplements, healthy routines, online social media promoted products or medications or something. And the medical community, it's not their fault. They're just not really sure where to go with everybody. They're following their algorithms, whether they be a internal medicine specialist or any healthcare provider for that matter. So, and I think the common denominator in a lot of the problems out there is airway health, and we see a significant problem with patients that come to us with airways that aren't functioning at their intended level due to multiple reasons. And we certainly should take a look at the connection between that and the rest of their health.
Yeah, totally agree. And because it's so common, it's kind of become normal. And our
Right.
population's been conditioned as we get sicker and sicker and sicker. There's no question if you look at the big data, and it's a global problem, not just the United States, but it happens to be especially heightened in the West, in the United States, for a lot of the reasons that we've talked about in the past, having to do with our environment, how we're born, what we eat, all these things. But I'd like to just comment and on a couple of things is, when we say airway health, what does that mean? And so I think it would be important to spend a little bit of time talking about it. And from the dental provider point of view, I will define it as relating to the caliber, function, and condition of the upper airway. From the lips, the nose, tip of the nose, lips, down to the vocal cords. That what facilitates our moment-to-moment ability to take that next breath with minimal to no flow limitation. easily. And so we don't think about, airway necessarily having anything to do with the oral cavity, and yet it's a key aspect of the airway. So as a dental professional, we kind of just assume it. It would be what, excuse me, we call as a functional space as we focus on the typical dental structures, right? The teeth, the gum and the bone that supports the teeth. Maybe we might kind of step back and look at the temporomandibular joints, totally ignore the tongue. We might look at the vault of the palate, but it's an elephant that's hidden in plain sight. It's that airway that starts developing from the moment that we're born. And so, as a dental provider, it's really important that we understand how the face grows early on, portends to how large and voluminous that oral cavity is, which is super important. And it worked fantastically for eons, except in the last 500 years or so, we know due to anthropologic studies that that's changed a lot. And it's affected by, again, how we're born. If we nurse versus bottle feeding, all these things that we've talked about. But why it's important is because taking the next breath is the most important function of any mammal, high metabolic rate. So we've got to be able to breathe easily through the nose 90% of the time. And yet you start talking to your patients that are clenching and grinding, maybe refluxing and things like that, you'll probably find if you start asking them and you start looking beyond just the teeth, that many of them can't breathe so well through the nose, or they complain that they're congested quite a bit, or they have allergies, they snore, all these things that have adverse effects on general health and wellness. So I'm just going to say that that's what we talk about when we're talking about airway health. Of course, if that's not working well, we're not sleeping well. Because if you cannot breathe easily and well, you're not going to sleep very well. Think of the last time your head hits the pillow, you've got a cold or a flu and you can't breathe through your nose very well. It's going to be miserable. So with that said, any comments on that? What do you think?
Well, yeah. I mean, I think that you nailed it in the sense that people don't always think about the nose and the oral cavity as being the most critical parts of the airway, because that's how everything gets to the lungs. And that's the area that has been so negatively impacted by how we were raised and by the environment. And as a result of modern society, what's happened to us clearly in the last 500 years or so, even longer in some societies. Quite frankly, I think that there were airway problems dating back to, the Egyptian civilization. If they were not in the field, they were being raised in a blue blood kind of manner. If they
Yeah.
were kind of taken out of their normal, where most people were raised, is in farms and trying to get food, and they were doing all the refined things in terms of their meals and things like that. So it's really interesting. I mean, I think it kind of depends on the society, but I think that the important thing for our listeners to really pick up on is that there is a true connection, and it can be measured, and we can see the difference in fatigue, behavior of the patients. We can see a difference in other health systems and organ systems when interventions are made by in the airway space. So we can totally change behaviors of a child in the family, which may impact the entire family. We can change the way a person go about their life in terms of their level of fatigue, their sleep, and I don't think it's obvious to us, Mark, but I don't think it's so obvious to everybody else. Otherwise, if it was, people would say, "Wow, I've got to make sure to take care of my airway." But they just don't know what they don't know. And a lot of it is that we can do is connect the dots for the patients and try to understand better why this truly is uh, one of the greatest reasons why other problems may exist. Not the only, but one of the ones.
Yeah, yeah, absolutely. You know, it's interesting. I had a new patient that came in yesterday from Texas. So I'm in California, and one of the many out-of-state patients that would come in, and she had gotten referred by a friend who had kids that I was also treating, who she had heard from a friend, and uh, and she brought in her, her 5-year-old son who's sitting in the chair, and I started doing my assessment and asking questions, birth questions, and as I was explaining everything, she just kept on nodding her head and she kept on saying, "This is fascinating. Why didn't I hear about this before? This makes so much sense."
Yeah.
Now I'm thinking, I need to bring in my other kids that are, 7 and 9 years of age. And to me, because I'm in this space and I'm so immersed in it, I'm just thinking everyone knows about it, because that's what I've been dealing with. And I do realize that it is the exception, not the rule, although we're fighting to make this the rule. Common knowledge that we as providers should really understand because it's so basic. So I'm asking, this, kid if he could breathe through his nose very much because I can't hear him breathing through his nose. And of course, he's super congested. That's his state, if you will. And mom describes how he's, bedwetting. He bedwetted till actually he's 6. He bedwetted till just a couple months ago,
Hmm.
and really high functioning, good kid, doesn't complain a lot, but also says, I'll talk to him and I can't. It's like he can't hear me, and I don't know whether he's ignoring me or he can't hear me. And I start talking to her about the studies actually showing high risk for conductive hearing loss with regard to, small palate. So he, as I described to her, has the mid face of a 3-year-old,
Hmm.
and here he's 6 years old. You could see it. It's like his facial growth is stunted, and
Right.
very high palate, venous pooling, tongue doesn't get there, and multiple problems. So I just mention this because day to day I see this, thinking that everyone knows it, but what was remarkable to me in my interaction with mom is how she was just saying it makes so much sense. I need to know more and learn about that. I said, look, the first step in practicing with Airway is really educating yourself. That's the first step. Really understand what the problem is. Because it'd be very easy to just have the provider say, oh, you just need palate expansion or you just need your tongue released. It doesn't mean anything if you don't really understand how it works or how it's going to change. So I'll just leave you with my thoughts on that as maybe we close this podcast on this one question. But does that make sense to you, Rich?
Yeah, it does, and I'm so glad you started talking about kids because kind of one of the other points that we wanted to make sure we discussed today was telling parents, teaching parents a little bit about what to look for in your kid and when they might be in trouble of having an airway problem that could be so beautifully corrected while they're growing.
Yes.
Take advantage of the body's ability to make corrections with a little help. And most of this can be very non-invasive and wonderful and high level of compliance. So, and you mentioned it, but I just want to repeat it again. If you see your child and they're functioning with their lips apart, they're basically their mouth is open all the time, that's a problem.
Yes.
If you see your child with crooked teeth, that's a problem. If your child has a hard time swallowing and or maybe is averse to certain kinds of foods, they don't want to eat certain foods, that's a problem. If they're acting out and they're super bright, but they're not performing well in school. That's a problem. When you look at your kid's face and you see dark circles under their eyes, another problem. These are all the phenotypes and all the conditions that we look at as providers, and it's just so blatantly obvious, but parents may see this and not know what to do. They may kind of think, oh yeah, I looked like that when I was his age, he'll grow out of it. Or they may think, oh, let's just take him to an orthodontist and we'll straighten out the teeth or something like that. And they don't really understand that the problems, all of those problems, are all stemming from exactly the same problem.
Yeah.
And that is to have a, a lack of limitation of flow of air into that kid's body, and that's really where it's all stemming from.
Yeah, and they're frustrated because the pediatrician asks them nothing about,
Nothing.
the breathing in the sleep.
Right.
It's like, what vaccine have you had? Well, let's stamp that card and get, or you're going to grow out of it. And that's where I find a lot of these moms, come in and yeah, do they snore? Are they sleeping on their stomach? Is the bed messy in the morning? Do they have inattention? Are they fidgety? I mean, the list goes on, right? And we
Right.
can talk more about those medical comorbidities that manifest with dental findings in another podcast. But
Yeah.
I would just say that isn't this interesting in closing, Rich, that here we are, two dentists that have a career really treating almost pretty exclusively for a long part of it adults, and now I'm seeing, I mean, mom yesterday was asking me about how young do you see kids. I said, look, I've had parents bring in 9-month-olds that are snoring or have a problem and they haven't been able to get an answer. And I tell them, yes, the earlier you catch the problem, the easier it is. And it's not necessarily that I'm going to do something about it, but I can direct them as to where to go and what to do and what the problems are. It could be a sleep and lounge pathologist. It could be,
Mm-hmm.
a well-educated, trained pediatrician or et cetera, whatever the case may be. But so even if you're, a prosthodontist or oral maxillofacial surgeon or, an ENT or you're treating adults, you have to know where the problem begins. And
Sure.
that's kind of where we are. And it starts in the birth process. So we'll just leave it at this for this podcast, and we'll continue our conversation in one of our next podcasts. And, as always, Rich, it's always great being able to kind of hash out some of these details, and appreciate taking the time, and look
Of
forward to
course.
our next top podcast.
Hey, and Mark, and congratulations on your new office. I can't wait to see it. You have a huge space that you're going to be able to take care of more people.
Yeah, thank you.
And it's exciting, stressful, but it's pretty amazing that you're doing that. Just a
Yeah,
little stressful.
yeah. It's
Just a
oh
little bit.
man, we're
Yeah,
still in boxes, but it's
yeah.
not a small matter, but it is exciting, and in fact, it's one of the reasons why we're cutting the podcast a little short today. Since I've got 5 people waiting for me right
I
now,
know you
but
do.
that's the way it is. But I think this is
Okay.
so important. So thank you so much, Rich, and we'll sign off. Talk to you later. Take care.
Okay, great.
All
Thanks,
right,
Mark. Take
you're
care.
welcome. See ya.